Welcome to the Oxygen Alliance YouTube channel, where we bring you videos on installation, maintenance, and various trainings on oxygen equipment and devices. If you have comments and/or questions, drop them in the comment section below or write to us info@oxygenalliance.org. Remember to like our videos, subscribe to our channel, and hit the notification bell.
Hello everyone, welcome and thank you for joining us for today's Oxygen Talk, brought to you by Oxygen Alliance. My name is Wade Kaembe and I'm a biomedical engineer for Oxygen Alliance, and I'll be your host today. So the Oxygen Talk is a virtual meeting where we discuss various topics related to oxygen. We organize this event every second Thursday of the month from 2 p.m. to 3 p.m. Central African Time. Today, we have a very informative and interactive presentation for you. The presenters are biomedical engineers from OpenO2. We have Michael Cimenti, Elizabeth Ntabalaba, Obe Chinkunda, and Goodluck Banda, who is unfortunately absent today and cannot present. But we acknowledge his absence and his work towards this presentation. We are also privileged today to have a special guest from FreeO2 as one of the presenters. She is Shira Bagayana, a biomedical engineer and a manager at FreeO2 Uganda. These presenters are experts in the field of oxygen equipment maintenance and documentations, and will share us with valuable insights into documentation of medical equipment in maintenance workshops. So I encourage you to take notes as we look forward to hearing from your questions and comments at the end of the presentation. So I'm hosting this call from Lilongwe, Malawi, and I would like to know where you're joining us from by typing your name and location in the chat. If you want to be added to our emailing list and get notifications of upcoming events by Oxygen Alliance, please type your email in the chat also. So without wasting much of the time, let me invite now Michael Cimenti to start off the presentation. Over to you, Michael.
All right, thank you so much, my colleague Lloyd. Welcome once again, everyone. My name is Michael Cimenti, as was introduced by my colleague. I'm a biomedical engineer working under OpenO2 initiative projects here at Global Health Informatics Institute. Thank you so much for joining us this afternoon. And in our today's talk, we are dwelling much on the topic of documentation in maintenance workshops and handling of medical equipment. So to make sure that we have a very participatory session, we have incorporated pro questions where they will rely on your active involvement. All right, so firstly, let's look at the outline of our today's presentation. So by the end of the day, we are going to cover the following things. We are going to have an introduction, types of documentation, the benefits of doing documentation, challenges in documentation, the best documentation practices that can be done in maintenance workshop. We are also going to see the open source tools available for keeping records, and we are going to have OpenO2 case study, and at the end we are going to have the case study from our guest from FreeO2 in Uganda. So we are talking about documentation. Maybe that pops in your mind, like what is all about when you are talking about documentation. All right, so when we are talking about documentation, this is just the process of producing and keeping written, graphic, or digital resources that offer details like guidelines, information about any specific topic, the procedure, a system, or any item, all right? So, did you know the OpenO2 mobile workshop team has come across over 80 different models of oxygen concentrators with 38 brands in Malawi since 2021. So using that information, we have managed to come up with the chart, as you see, which is taking different brands, about 38 of them. So this information is very important when it goes to health facility, because they might be able to make decisions, especially from the authorities, maybe if they want to procure a new device or new brands. So we have managed to come up with this information because we were able to document, so we can quantify everything if we have documented everything that we are going through. All right. So looking at this, we can go through the types of documentation. So there are different types of documentations that we expect to find in any maintenance workshop, and these have to be done. So the first type that we are to see this afternoon is maintenance logs. These are just documents in which the health facility used to record all medical equipment maintenance activities, right? So these documents, they enable institutions or health facility to monitor their system checkup processes, and also to check who has done a certain activity on a medical equipment or who performed that, and at what exact time was that performed. And at the same time, what was the purpose for doing that? So through documenting all these, you find that it is very easy for you to know if the equipment is performing well and it is in compliance with any regulatory requirement. So as you can see from the screen, there is an example of a maintenance log where it is having different sections. So from that document, you see there is equipment name, the name of the manufacturer, the manufacturer details, the date which that equipment will be in service, and it has also a section of maintenance activity that has been done. So like who did that activity, right? And the description of the activity which has been done. So moving forward, we can also see the other type of documentation, and the other type of documentation that we can find is equipment labels and the tags. So when we're talking about equipment labels and tags, these are just the physical markings or identifiers that are fixed in various types of equipment, and you can find them in health facility, and they are there with several purposes. So if you want to identify the equipment, if you want to see how safe the equipment is, if you want to track the equipment or to check if it is in compliance with any regulatory requirement, so you can use these labels again. So we have a simple example, as you see on the screen. That one is for physical under the Ministry of Health. So if you have a look at it, it has different sections having different information. So there's a type of an activity that you've done. Did you do a planned preventive maintenance, or was it a corrective maintenance? When was that, right? So what's the status of the equipment? Then you put your comment. So this is very important to be put into consideration. So moving forward, the other type of documentation that you can find in the maintenance workshop, or we can do, is job cards. So the job cards, these are just documents that are used to record and manage the maintenance, repair, and servicing of the medical equipment, right? So this one serves as a systematic way to document and track the work performed on each and every equipment, and that makes sure that any equipment is maintained correctly and it is in compliance with any regulatory standards. So we have a simple example, which you see from the screen. This one is for physical asset management. So this is corrective maintenance job card, right? So it has different sections, right? When the activity was done. So you put all those information, like the job number, the equipment description, what you did, where that equipment is coming from, its department, right? So the room name, you put the serial number, all that information have to be contained in this document. So the other type of documentation is the equipment inventory. I'm sure that by just mentioning inventory, that pops up in our mind, like inventory, I've ever heard about this, right? So when we are talking of inventory, this is a mother of all documentation which can be done on an institutional health facility, because it takes all information about the medical equipment or device which you might have on your institution, right? So it includes the details like what name of the device, like what's the model, the serial number, the location where you can find that equipment, any maintenance history that have been done on that equipment, right? So any relevant information about testing or calibration, any materials, that's the spare parts, the consumables that have been used. So you can see that this type of documentation is not a dormant documentation. It has to be updated. So with the time, you find that you are having new information being updated. So today you may have the other information, tomorrow, next year, everything that has been done on equipment, you have to update to this inventory document, which is very essential. So the other type of documentation is maintenance request form document. So this one just acts as a communication between the department, which is using a certain device or a machine with the maintenance workshop. So, for example, those who are working maybe in central hospitals, we have different departments. We have beds, we have physiotherapy, we have orthopedics, we have ICU. So, suppose maybe in the ICU, maybe the ventilator or suction machine maybe has stopped working. So, it means somebody who is responsible, they has to report to the maintenance team. But the report has to go through this document. So, they write down the problem which they have encountered, right? So it means the maintenance team will just go through the form and say, oh, there's this problem. So they will maybe select one who is going there to rectify, or else if the device is mobile, which can be taken to the maintenance workshop, then it will be maintained. So as you see from this template, it is having that information, like who requested, the name of the requester, the department it is coming from, the date, the contact details, whether the problem is the agent, its agent has to be rectified, or anything which has to be communicated is written on this document. So that's very essential, very important. Now, we are going to have a pro session. We are going to have a question. So I will go through the question, and I'm sure that yes. So we have this question. Do you use any form of maintenance documentation when handling medical equipment at your facility? So this question goes to you. Have a time. You can vote. Then after finishing looking at the types of documentation, I'll come again to read what you have voted for. So we are moving forward and to see the last type of documentation. So the last type of documentation is the incident report. So the incident report, these are just documents which takes the information of any unexpected event or situation that might have happened in the whether working station or in the workshop or in the department, in the ward, wherever. So if there is anything that has happened, that has to be documented. If there is any injury which has been attained, that has to be documented. So the information you expect to have, you see, like when was that happened, right? So you put date, the location where that happened, whether it was at base, whether it is in working in the workshop, whether it was in any department which that has happened, or any place which that has happened. So who was involved? What injury has been attained? Any immediate action which was taken. What was the root cause of that? So all that has to be documented. And if you put that information in the report like this one you have documented, it's very easy for somebody to follow up, right? So now I can go back and see how people have voted according to the question that we had. So it shows that about 9 people have voted. They are saying yes. We have. All right, this is really fascinating. This is really amazing. All right, so as we are moving forward, this time around, I'll call my colleague, Elizabeth Ntabalapa, to come in and proceed looking at the importance and the benefits of having documentation in a maintenance workshop. Thank you.
Thank you so very much, Michael, for the beautiful presentation. Indeed, my name is Elizabeth Ntabalapa, and I will take you through the importance or benefits of documentation. So, documentation is really vital in the maintenance and handling of medical equipment for several reasons. So, here with me, I have different reasons, and the first one is traceability. So, documentation provides a complete history of an equipment's maintenance and usage. So this traceability aids in identifying issues and tracking repairs and even making informed decisions about when to replace or retire an equipment. And moving forward, we also have cost management as one of the benefits that we get out of documentation. So if we have effective documentations, it allows the healthcare facilities to budget for equipment, maintenance, replacement, and upgrades more accurately. Actually, this is helpful as it also allows the health facilities to do cost control and do a better and reasonable resource allocation. The other importance of documentation is compliance and regulations. So, since healthcare facilities must adhere to those strict regulations and standards, the proper documentations ensure that equipment maintenance and handling meet these requirements. So in this, with the act of having all those proper documentation, it helps that the equipment maintenance and handling should meet the required regulations. So it reduces the kind of risk that can actually come along when we are actually violating those regulations. So every time we keep records, we are safe that we cannot end up or fall in any situation whereby we are violating any comparison regulations. Another importance that we get from the documentation is warranty and vendor support. So maintaining accurate records is essential for warranty claims because there are other equipments that the vendors are the ones who actually needs to be maintaining them and following up with the claims. So if we are able to have those documents ready with us, we are so free as the facility to actually claim those warranties and also to make sure that our equipments are properly handled and maintained. Another importance that we have is quality improvement. So analyzing equipment documentation can reveal the patterns of malfunction or wear, and this leads to improvement in the equipment selection and maintenance processes. So we're continuing with the importance of documentation, and the next one is legal protection. So in case of malfunctions or any adverse events, well-documented procedures can provide legal protection by demonstrating that the equipment was really handled and maintained in accordance to every best practice that needs to be done in the facility. And moving on, we are having risk management as another benefit that we gain from doing proper documentations. So again, this one, it helps the facility to identify and mitigate any kind of risk that can be associated with the medical equipment. And this facilitates that we should have a proactive measure to reduce those issues. And another benefit that we get from documentation is that training and knowledge transfer. There is a proper training and there is proper transfer of knowledge for the people working in the maintenance or the workshops. So each and every record that we are having pertaining the equipment maintenance procedures, if they are available, well documented, it ensures that the knowledge can be transferred from one personnel to the other. So if there are any other changes happening in the workshop, we are able to transfer even with the details of each and every information that was done in the workshop. Last but not least, we have another importance of documentation, whereby we are having the help of maintenance scheduling. So well-documented schedules ensure that equipment is serviced regularly. So we are able to know, so this machine was worked on such a date. So after this much time, we need to schedule another maintenance time. So it is actually there to just help us to understand of when we need to do the maintenance again. And lastly, we are having patient safety to be a benefit that we gain if we go through the proper documentation. So accurate documentation helps to ensure that the medical equipment functions properly. So this reduces the likelihood of errors or equipment failures, and that could harm any patient. So in as much as we try to make sure that everything that we're doing in the hospital is safe and sound, documentation also plays a very big role in providing this safety. So after seeing the importance or benefits of documentation, now let's look at some of the challenges that we may face in the course of practicing documentation in the maintenance workshops and handling of medical equipment. So our first point is resistance to change. So it can happen that staff may resist adopting new documentation system or practices. And obviously, this hinders the implementation of something which is more efficient and effective. So if we're having this, it is a challenge for the facility to get all information that it needs. Another challenge Another challenge that we face during documentation is outdated documentation. Mostly this is experienced when there is failure to update documentation to reflect the equipment changes or software updates, and many times these situations lead to errors and inefficiencies in the facility. So it also brings compliance issues. So we are finding this to be a challenge as well. Next, I will talk about lack of incident reporting. So as my colleague Michael mentioned of what incident reporting is, so incident related to equipment malfunctions or accidents needs to be documented and well reported. Actually, failure to do this, again, it compromises the patient's safety. Another challenge is inadequate record keeping. So failing to maintain comprehensive records of maintenance history can lead to more inefficiencies and difficulties in tracking equipment status. So we can't know when we are having the next servicing schedules, and even we can't understand the performance trends of the equipment. This just shows that it is also a challenge. And moving forward, we have incomplete maintenance records. This happens actually maybe sometimes in the when the maintenance technicians may not do all documentation of all aspects of their work. For example, if they're not showing the maintenance tasks performed at the workshop or the parts replaced, and all this incomplete information literally hinders future troubleshooting and decision making. Another challenge that we have in documentation is failure to capture critical data. So there are other information that we really need to get to understand and record them. But because they are hard to access them, it may be, for example, from an oxygen concentrator, let's say the ones that just show oxygen concentrator, it is hard for you to get information like the brand, the model, and even other important information that needs to be recorded in the maintenance workshop. So this one is also a challenge as it is crucial in the usage of that machine. And lastly, we have disorganized documentation as a challenge that we face in documentation. So any poor organized or stored documentation makes it challenging to retrieve that information quickly when needed. So this can lead to inefficiencies again and delays in maintenance activities. And addressing these challenges, all the challenges that I've mentioned and pitfalls in the maintenance handling of medical equipment, documentation, it really requires a commitment to clear documentation strategy. So actually for us to achieve the best of our work, we need to follow different best practices, which will be explained by my colleague Aubrey. But before I do that, we're going to also launch another poll question, which is saying that what do you think is the major challenge in maintenance documentation and handling of the medical equipment? So please respond to the poll question, which will then later be responded to again on how we have answered. At this point, I'll just let Aubrey to take over the floor. Thank you.
Thank you very much, Elizabeth. Hello, everyone. My name is Aubrey, and I'll take you through the best practices when it comes to documentation. Let's get started. Firstly, it is encouraged to have a staff sign-off system so that you can easily encourage accountability at the facility, and also to have easy traceability. So if you maintain an equipment and you sign it off, you can always come back and check who did the work and what type of work they did on the equipment. So it is encouraged to always have a staff sign-off system. It is also encouraged to have an equipment usage log, so to track the number of hours on the machine and also the cycle of usage for the equipment. It is also encouraged to have vendor and supplier information. This helps when you want to contact the supplier or the vendors for vendor support when it comes to malfunctions or different procedures in the commissioning of various equipment. When it comes to emergencies or incidents, as it has already been mentioned by my previous colleagues, it is encouraged to always have emergency handling protocols so that you can always refer to them when there's an emergency or an accident. It is also encouraged to always have emergency service contacts available and always develop plans for equipments in case of disaster. Most of the equipment that we have in different facilities already have serial numbers, but it is encouraged to have your own equipment identification numbers just for uniformity, because various serial numbers are going to differ across various equipment. So when you have equipment identification numbers that are uniform, it makes the work easier. It is also encouraged to have control over access to the documentation. So not everyone should have access, or only a number of people should be accessing the documentation, the different types of documentation. Moving on, where it is also encouraged to have all the documentation stored in one place that is organized, easy to access, and also secure, such as a digital management system. Make sure that you audit and verify the documentation regularly, and ensure that it is up to date and it is reflecting the situation on the ground. Also, make sure that the type of documentation that you're doing is complying with the regulations. I think it has already been mentioned about the different types of documentations that are there, so you can just select from that list the type of documentation that you would like to apply at the facility, and then see how it's going to help you. Moving on from the best practices when it comes to documentation, now let's look at some of the open source tools that are available for collecting data that can be used for documentation. We have the ODK, which is the one at the top of the list. It's available for Android. We have the GIC Collect, which is an alternative version of the ODK, and it's available for iOS. There's also the Kobo Toolbox that is just below that. And you have all other various software that can be used to collect data. You have JotForms, you have CommCare at the bottom. So you can take advantage of all these tools and see how they're going to help you out in collecting the data. Now that we have talked about the open source tools, let's focus on the OpenO2. We're going to share how we handle documentation here at the OpenO2 and how it's helped us so far. So this would be like an OpenO2 study on how we conduct our documentation. So firstly, that's an OpenO2 job card. As my colleague Michael already stated about the job cards on the different types of documentation, this is a template of the job card that's used here at OpenO2. As you can see, it has various details that you're supposed to record: the facility name, the visit period, the date, the word, the model, the registration number on the oxygen concentrator. So this is what we use to collect the data of all the maintenance work that we do in the various facilities. And this is more like the paper-based version of the documentation that we use. From this, we're going to talk about the electronic methods. And we, as I mentioned earlier, we mainly use the ODK for collecting most of the data, also known as the Open Data Kit. It's an app that's available on App Store or Google Play. You can easily download it to your phone. It's mainly available for Android. So if you want to use it on iOS, you might need to download GIC Collect. But for ODK, it's available for Android. You can download it on your phone, Google Play, and you have to configure it with a Gmail account. And a link will be pasted in the chat on how you can configure the app with a Google account. After you do that, after you download the app and you open it, the interface will look like this. Of course, this is in the dark mode, but then it also has a light mode. Let's focus on the image on the left. Firstly, you have multiple options. You can fill blank form, you can edit saved form, send finalized form, up to delete saved form. So you will need to develop your own forms for data collection that will collect the various data that you need. Here at OpenO2, we have 4 main forms that we use. We have the purity form, the compressor registration form, the oxygen concentrator registration form, and the triage. So we have these main forms. I'll go over them in the next slide in detail, but these are the forms that we use to collect our data. So moving on, as I mentioned, you might need to create your own forms. So you can create the forms using Excel or Google Sheets. If you do not have any knowledge of Excel or Google Sheets, you can use an online form builder that can be found on the website of ODK. It's a pretty straightforward process. You just click and then add in the various data that I can say the various input fields that you want to use to collect the data. So for the concentrator registration form that we have, it's used for registering oxygen concentrators, various facilities where we go to. We also have the compressor registration form. This is for registering the compressors that are found in oxygen concentrators. We have the final purity form for registering the purity of the oxygen concentrator after we have done the maintenance work. If you found the concentrator at 40%, you fixed it, now it's producing oxygen purity of 95.6. You have, this is the form that you use to now register that you have fixed it from 40% to 95.6. Lastly, we have the triage form that is used to record all the missing parts on the oxygen concentrator. That way we have data that points to all the commonly missing parts in the concentrators found in Malawi, which helps in when we're purchasing spare parts. We know which parts we're supposed to purchase in bulk. Another amazing feature of ODK is that it allows you to work online and offline. If you're working offline in a facility that is in a remote area, you can do your data collection, but as long as after you get connected to the internet or Wi-Fi, all that data will be sent to the database. And most of this data is stored in a Google Sheet that you also have to configure once you download the app. And you can also use the ODK server, but then you might need to pay for that. But if you want the free version, then you use the Google Sheets. Let's move on and look at some of the labels or equipment stickers that we use here at OpenO2. We mainly have 4 types of stickers that are used. As you can see on the screen, we'll start with the images on the left, mainly at the left corner. That's a concentrator registration label, and as you can see, it has a barcode. That barcode embeds the ID number of the oxygen concentrator, and if you want to extract it, you can easily scan with your phone. So you can scan the ID number, and you can also record the purity and the test date. After that, on the bottom left, there's the compressor service label. This is the one that we use after we have done maintenance work on a compressor that is inside an oxygen concentrator. You can record the service date, and you also have to tick against the maintenance work that you have done. So if you have replaced the piston sleeves, then you tick against the sleeves. If you worked on the piston cups, you also tick against that, and so on. On the right, on the top right, we have the final purity label. As I mentioned, if you have fixed the concentrator from 40% to 95.6 purity, this is the label that you're going to use. You're going to record the purity, 95.6, and also record the test days. As you already know, that here at OpenO2, we do zeolite regeneration. And this is a sticker that we use for the seed beds that contain regenerated zeolite, just so they're kept separate from the other seed beds that contain zeolite that is purchased. So this is the sticker that we use just to separate those 2 types of seed beds. And these OpenO2 labels were designed using a software called the Zebra Design software. There are multiple softwares that can be used, and this is the one that we just found easy to work with. mainly because we already have thermoprinters of the Zebra brand. So the thermoprinters and the software are compatible. So we found it easier to just use the software. And this software can be downloaded. Link will be pasted in the chat. And you just go there and download the software and install it on your laptop or PC, or whatever machine that you're using. And it has multiple options. You can include a barcode on your equipment sticker. You can design various shapes and also include various texts. There's also an option where you can print the sticker once it's designed. So as I said, the Zebra design software is compatible with the Zebra thermoprinter. So you use that option after you have designed it and you have to print it. So for the Zebra printer, we mainly use the TLP model, and you also need to have the power supply and the thermoprinter labels. These are the accessories that you need to print the stickers properly. So now that we have talked about the open source tools, we'll talk about the challenges or disadvantages with using these open source tools. But before we go to that, we're going to also launch a poll, because we have shared the software that we use to do our documentation, and we're curious to learn from you guys, everybody on the call. What software do you use? So there's going to be a poll that is launched. What software do you use at your facility for medical equipment documentation? So you can select from the list. And also, if it's not listed, you can type in the chat. We just want to learn and see if it can also benefit us. On the challenges, mainly, most of the open source tools do not do data validation. So you have to manually do data validation to reduce duplicates. It does not do data analysis. You need third-party software to do that. And also, the databases do not have relationships. So it's very difficult to get organized info, to extract organized information from the Google Sheets, which act as the databases. So those are the main disadvantages of the open source tools. And that's it from me. Now let me look at the the poll that we just launched. It seems like we have multiple people that use the ODK, Kobo Toolbox, and also some people have typed in the chat. So right now, let me hand it over to our guest, Sheila from 302, to tell us more about 302 and how they do their documentation, and also what impact it has had on them. Thank you very much. Over to you, Sheila.
Thank you so much, Aubrey, for the very insightful presentation. Sheila Bagana from Uganda. I'm currently working with 302 Foundation, and our work involves installation of innovative oxygen technologies for the lowest remote facilities. Today, I'll be presenting a case study on the work that we are doing, and specifically on documentation that we use at 302 to ensure that we are maintaining all the records of the many concentrators that we interact with on a daily basis, and looking forward to learning and listening more to what everyone else on the call thinks. So basically, I've already talked about who we are. We are a local NGO that ensures that oxygen access is for all. So whether rural, hard to reach, that's our biggest focus, and specifically for pediatric oxygen. We are currently in 22 health facilities where we have over 40 not different, same brand of concentrators, but different units of concentrators. So it's really important that we maintain our documents so that we are able to manage our inventory. Yeah, so why documentation is really key and priority for us. One is for inventory management. So we have quite a number of equipment all over the southwestern region. So it's important for us to know what's at office, what are the different facilities, what equipment is at the facility, what has failed, what's working, the spares we need, evidence of work done. So whenever work is done, it's really, really important that whatever you do on an equipment is recorded. So whether the technicians are regional technicians who are working, we need to know what exactly they've done on the equipment. So we need to know what exactly has been done, or even knowing if the concentrator is being used. For example, if they log in the same work hours for the last time you checked the concentrator, it had run hours of, say, of 600. You check again, it's now 600 still, then you know this concentrator hasn't been in use. Standardization of work and future referencing. This has been explained prior. So with our document, it enables us to ensure that whichever engineer or technician is out in the field, they're doing the very same thing. So how we are able to regulate or monitor how, say, I would personally do maintenance of a concentrator and how my colleague would do maintenance would be by having documents and following them. And future referencing, say, what do our records look like? How many maintenances have we done? How are the equipment functioning? How long is the lifespan of the equipment we're working with? What are the current failures? At what hours do they normally occur? So that also leads us to data analysis and tracking performance. So with the data collection, we're able to track performance and know even the facilities that have a higher demand than that have a low demand. We're able to, again, track performance, usage of spare parts, working hours of our staff, and it can also be used as a performance tool. For example, we say that an engineer who works with us, say who manages a hub, will be able to manage, do maintenance of this number of concentrators. So what will actually gauge that is actually looking at the documents and seeing that they're actually doing this. Okay, so I could say maintenance documentation usually covers the following aspects. So the equipment itself, you need to identify the equipment, which is done by the serial number, the models, the spare parts. So especially if it's preventative maintenance or corrective maintenance, we need to know the spare parts details, what spare parts were used, how many were used, which ones were replaced, which ones were just cleaned. Equipment performance, so in terms of run hours, in terms of the general state, the condition, the work done. So this is the actual work done by the engineer or the technician, and this can also include the tools used, calibration methods, product evaluation. So these are recommendations of finding or feedback. So sometimes a technician will work on a device and he says, based on what I think, this is what I think we should pull this device from this facility, probably because they're not using it, based on this, this, and this. So this is where that comes in. And then, of course, the team which has done the work, the date, and the facility specifics. So since we work with different health facilities, we really like to engage the facilities in maintenance. So we make sure that someone from the facility always authorizes that work has been done, and they can actually supervise our technicians when they go to the facilities to ensure that they are participating in maintenance and know what it takes to actually do maintenance. So I could divide the documentation that we do into 3 different parts. That's pre-maintenance, maintenance, and post-maintenance. So under pre-maintenance, we're looking at maintenance guidelines or SOPs. So different SOPs for doing different procedures, as we'll see in some of the documents that we have. Spare parts list. So this is what you compare against, you know that if I'm doing a 6 months preventive maintenance, these are the spare parts that I need, and these are the numbers these are their spare parts numbers, and they are available in store. The inventory, that goes without saying, always updating the inventory, and also helping us locate the different areas where these concentrators will be, or devices. Facility notifications. So this can be either the facility notifying us that we are currently experiencing a problem, please come and check on this concentrator, or us notifying the facility that the concentrator that's currently, say, at pediatrics ward is due for maintenance, and we'll send our team over. Incident reports, so this can also fall under facility notification. So immediately they notify you or something happens, this is filled, and then we can decide the next route of action to take. For maintenance, we have maintenance logs, job cards, maintenance register, of course, the inventory, which is key for all biomedical workshops. You should have an inventory and keep changing it as you do work, or revising the inventory. It should be a moving document. Spare parts inventory. Then for post-maintenance, we have the maintenance stickers that are left on the concentrators, SOPs, protocols, user guides for users. So this can be maybe based on the maintenance. You notice that the staff haven't been doing a great job. So then you draft a better user guide to support them to use the equipment better, and incident reporting. So at Frio 2, we use both soft copies and hard copies. So usually our very first is the books. So we have an annual maintenance register where we have the name of the spoke, the month of maintenance, and the volume. So we can have volume 1, volume 2, volume 3. And what actually is in that annual maintenance register would be a document like this, which has the name of the facility, where it's located, the date, the complaint, the work done, the signatories from the facility and also from our own engineers who've done the work, and recommendations. And we also have where we specifically include, say, if we're doing the 6 months annual 6 months maintenance, we say, okay, how to test for leaks, this, do this, and this. Okay, have you done it? Yes. Then comment, say, maybe I did this and it passed. So we are able to then, so we integrate our guidelines with the actual register so that we know exactly what has been done and the exact spare parts that have been used. So I think this is the same. So when we do, for example, leak testing, we go through the procedures. So the engineer goes through the procedures, can complete whether they've completed that procedure or not, and then can give the notes based on the work that they've done and the results that they've got. And these documents are always changing based on the need. So sometimes you see that we've missed out something and we really need to add it. So we'll change the version of this document and we'll say, okay, this is annual maintenance register version 1.2. Yeah. So data documentation has been really key and is central in the work that we do. And from data collection at the facility, at the sites, and also with our technicians as they go out at office, managing the inventory, managing the spare parts inventory. All this data has been important for feedback and learnings. We've understood so many things, and we're able to use some of our softwares to actually generate some reports. So we can see the facilities that have the highest usage, the facilities that have the highest breakdowns, and we can come in and try and understand what exactly is happening. And we try to do this on a quarterly basis just to understand the data that we're getting from the facilities and what that means. Support activities such as stakeholder engagement. So these reports have been really powerful tools for us to advocate for biomedical engineering in the facilities, because once facilities appreciate the work that we are able to do, then they appreciate the services that we are providing, and they are able to support their patients better. Data analysis. So all this data we collect is usually analyzed, and we're able to understand the best make, the lifetime of the equipment, the spares, the costings, etc. So lastly, these are a few points that I thought are important for us to highlight. One, sometimes it can be hard for engineers, technicians to record and write, but just know that it's not done unless it's written. So make sure that you always have evidence of whatever you have done by either doing the job card, having your maintenance logs, and all your documentation in place. Keep both soft and hard copies and review them. So as we enter the data into soft copies, we usually review to ensure that everything is up to date. Utilize the documentation for impact. So we found this as a very useful tool as we go to facilities and let them know probably what's affecting their concentrators, the number of patients they're able to receive based on the data that we collect. The documents can be improved over time. So once you have a document, that's not the end. It doesn't mean that that's the end of it. It can keep getting better and better. So as a team, as a workshop, you make sure you keep updating the documents to meet your current needs. And documentation will save you. So my colleague earlier mentioned that documentation is key for patient safety. And just in case anything ever happens to a patient, there is your backup plan to show that you as the engineer, as a biomedical engineer, you've done your part to maintain the device, to do all the best that you could do. So always have that to ensure that that's your backup in case anything happens. So thank you very much for listening in. I would like to hand over to the Oxygen Alliance team, and thank you all for listening in.
Thank you so much, our engineers, for that wonderful presentation. This has been helpful, and I think now a lot of you have some questions. I will try to take a couple of questions. So feel free to raise your hand or type your question in the chat, and I'll make sure to acknowledge and provide an opportunity for you to ask. So now it's time for questions. All right, so as you are cooking up the questions, I think I can just share you the poll results. So the first question was, do you use any form of maintenance documentation when handling medical equipment at your facility? So we had almost 16 votes on yes, so most of the people use some kind of maintenance documentations at their facility. The second question was, what do you think is a major challenge in maintenance documentations and handling of medical equipment? So negligence had the most of the votes. So it looks like that's the main challenge that most people face during maintenance documentations. And another question was, what software do you use at your facility for medical equipment documentations? So it looks like ODK is the winner. So yeah, Kobo Toolbox had 2 votes, and 2 votes on that. We don't use any software, and 2 votes on other. So I think some people do use another type of software. So I think you should have typed in the chat, so I didn't see any here. All right, so any question from our audience? This is the time. All right, so I think it seems that most of you don't have a lot of questions. Just make sure you type. All right, so we have a hand raised. Mark Sanderos, I think you can come up mute and ask a question.
Okay, maybe first of all, let me start by thanking you for this presentation. I've learned a lot, but I would also like maybe to know how maintenance, like taking documentation, would be very important to an engineer perspective, not necessarily a technician who is just there to maintain. But if you are designing something, how can documentation help? Because I feel like it can also help. But before maybe I bring my suggestion, I would like to know from you, because it seems that you are very professional in this. Thank you.
All right, I think Aubrey can take the question.
All right, thank you, Lloyd. So, yeah, we also do documentation here mainly when it comes to designing. And what we do is we document almost every process. So there usually, let's say we're tackling a certain feature, or let's say we're designing, for example, let's just say we're designing a solenoid valve, right? There are multiple ways that you can go about designing a solenoid valve. After we do the design process, we select one, and whatever we have done in that process of designing the solenoid valve, we document everything. And then after we have tested it, if that solenoid valve is not working, we go back to our documentation and see if there are any mistakes that we have made. And that's just I can say a miniature version of it, but all the projects that we conduct here under OpenNode 2 or at the Global Health Informatics are documented so that everybody else can have information on how that project was done and follow up. And also that way they can easily add in information on they can add in information on how best it can be done. So if they have an idea of improving it after they follow up from the documentation, I think they can easily do that. Yes, I think that's what I can say. Yeah, I think my colleagues also have other inputs. Thank you.
Elizabeth, I think you can just add on that, and then we wrap up the presentation.
All right, yeah, thank you for the good question. Actually, I just want to add up on what Aubrey has said. And in terms of the project or designing, actually, we actually need to go through each and every step and documenting each and every step. In as much as there is a problem that you need to solve in designing, from the problem statement, from the literature reviews, from the concepts, and everything that you want to actually produce as the end product in solving a certain problem or innovation or in designing, we actually are assigned to do that. So even here, we have different platforms where many times we keep the data that we are working on and even the information that we are working on online in either maybe Google Docs, whereby if that project, that person leave it in suspense, somebody can come still and follow through what was done before and continue with the project. And not just that, all this documentation, it even shows you the good flow of how you can go about with the project, because we are able to track the flow to say, okay, we have done the reviewing of the literature of how we're solving this problem right now, and I think now we're going to adopt this concept, and after that, even reaching to the point of designing and solving the problem that we were having as a problem statement. So actually, I just wanted to concur with Aubrey that in each and every step of the design system or process, we document everything for future use, and even as we're doing it, for tracking the whole process of designing. Thank you.
Thank you very much for the beautiful answers. Yeah, I think now I've learned a lot. So maybe to just link it up, maybe I think it would even help into finding problems like where should we improve, because if we are fixing an oxygen concentrator and then we discover that each and every month we are maintaining the same part, then it can tickle our mind that we can design something so that we focus mainly on that part. We should be strong in that part. Thank you very much for that idea. Thank you.
Thank you so much, our engineers, and I hope, Mike, that was clear indeed. So, so this marks the end of our Oxygen Talk today. So we appreciate the efforts made by our engineers to come up with this presentation. If you want to watch this Oxygen Talk again, you can visit our YouTube page, where we are going to upload the recording of this call. And if you want to learn more about Oxygen Alliance, please visit our website, www.oxygenalliance.org. And if you have any questions, you can email us at info@oxygenalliance.org. Once again, thank you for attending this Oxygen Talk. We appreciate your time and interest. Have a wonderful day and stay healthy. Goodbye.